the backbone of America.
Dr. Joel Gator, thank you for joining us. So let me do a quick introduction for you, and then maybe you could add anything you'd like to. But so you're a board certified integrative and holistic pediatrician based out of Los Angeles, California. You completed your residency at the prestigious Children's Hospital of Los Angeles, consistently rated among the top in the nation. You've authored several books, including The Parenting at Your Child's Place and Between a Shot and a Hard Place, among others. You have a very large following on social media, which is not very common, I guess, for doctors, but nonetheless. And most importantly, and I imagine what makes you the most happy is the two beautiful children that you have with your wife, Sarah. Thank you for joining us here today. Did I miss anything?
Thanks for having me on. No, I think those are, I mean, I do lots of other things too, I guess, but those are the main ones. So I think it's a good intro.
Yeah. So my first question for you, this is a podcast called The Backbone of America. We try to highlight entrepreneurs and individuals that are going out and venturing into their own businesses to discuss mostly the economics of their business, how they succeed. Every business needs to make money, even though we have secondary or even maybe a primary objective, but we all need to pay the bills. So this is what we're all about, how to make, keeping America great, keeping it the best nation in the world. And so my first question for you is, define your line of business and what sort of services do you offer?
Well, my main business would be as a medical professional. So as a doctor, seeing patients, getting paid for seeing patients in the office. And then I would say secondary would be, I don't know what the term would be now. I guess influencer would be the word. I don't know. Getting paid to do social media stuff or advertising or courses and programs and supplements and other things. So whatever the catch-all term is. That's it's a weird world, because obviously when you go into medicine, you never really you don't get any training on social media or business or any of this stuff. And for me, as a sole practitioner, as a person who runs a business, it's a little different for medicine, because you're running a business and then seeing how social media has taken off and leveraging that to help get information out there. But also it is a nice way to be able to at least cover costs for some of the things that I do, and then sometimes make money from social media too, which is nice, because I do spend a lot of time creating content. Most of it's for free.
Absolutely. So what was your idea when you started the social media? I imagined it was to help your practice, get more clients. But now that I think about it, there's so many things that you can do to monetize, which would be like, selling supplements. You can have your own brand that for whatever you think, would keep a person healthy, or, the kids. You can promote yourself. You can have conferences. Tell me a little bit about your thought process when you said, I want to be in this business. I want to compete in, social media.
Yeah, I think a part of it is what you said. It's certainly a part of getting on social media and actively posting. It's marketing in a way. It's a newer way of marketing, because you're posting. People are getting to know you. They're seeing what you're saying on a daily basis, and we do get a lot of clients that say, "Oh yeah, I saw you on this post," or "Oh, I saw you talking about this, and I really appreciate what you said, and it really resonated with me." So I think that's a part of it. A lot of it just started just to get information out there. So for me, I only see so many patients, and I had found that people were really interested in, especially the integrative spin on medicine. And you only have, a couple hundred, maybe 1,000 patients, but there are so many people that I feel like could be helped with this information, or that could use this information, that were liking it. And so that's what really led me to start posting, and then watching over time how engaged people got, how much people liked it. It has really helped me to continue. And I think to see it grow has been really exciting. But I don't know that I would say that I originally did it to make more money or to get more clients. I think it's a nice benefit of it, but it's certainly a nice side effect, I guess, of promotion.
And when you say integrative, for our viewers that don't know what that is, I wasn't aware. I had to look it up. That's more of like a holistic approach to medicine, right? It's less reactive and more proactive, I guess.
Exactly. So integrative means balancing the different worlds of health out there. So I did all the regular medical training, Western medicine, medications, that kind of thing. But I have tried to learn a little bit more about prevention and healthy eating and nutrition and exercise and supplements and herbs, and try to blend those together in the office. And people have really seemed to like that. And I think more people are looking for that, especially these days when so many of us are sick and have a chronic condition or asthma, allergies, autoimmune,
Yeah.
really looking for answers outside of the system, or at least trying to focus on, okay, what can we do to prevent it or minimize our symptoms? So that's what I do in the office. And then again, even from again, you're going from a business standpoint, like this is something that differentiates the office from a lot of other offices, which is really helpful for those that are looking for those kind of services. Is something we can offer that's a little different than the average medical office.
Right. Is this in the same direction that RFK is going? I mean, are you guys aligned as far as your values and the same thing as far as health?
I think to some degree, yeah. I mean, anyone who's in politics or anyone in that position, you're going to agree on some things and disagree on other things. But certainly, we agree on a lot in terms of needing changes. I've been involved somewhat in the Maha movement and been an advocate for change. So a lot of what he does stand for, I would agree with, or at least want to see change in those same areas as well.
Understood. Now, tell me something. How fast is this industry growing? I mean, are they going to doctors more on average? I mean, obviously the population's growing, and it's not something, I mean, it's not a business that you want growing, honestly. At least you don't want, children, particularly when you focus on, going to the hospital more. But tell me a little bit about maybe the last couple of decades of, is there a lot more work per child, or has it gotten better?
I mean, it's tough to answer that question because it's such a big question when it comes to health. I mean, in a general sense, people are less healthy. So there is more expenditure on health than ever before. I mean, we spend so much of our GDP on health in America. It's just growing to the point where it's not going to be sustainable very soon. So just overall, yes, it's a tough industry because you have to go through insurance a lot of times, and the reimbursements are very difficult.
Yeah.
And so that's a really tough part for a lot of doctors. But from an integrative perspective, integrative practice, I mean, that's definitely growing. We turn away tons of people that want to come. I mean, I could have 100 more offices and it would still be full. I think it's something that people want. And there just aren't that many people doing it. But from a general medical perspective, yeah, people are more sick. They're needing more visits. It's taking longer to get in, and it's not a great space at the moment. I mean, there's a lot of change that's needed, I think, because the system's not really meeting the needs for most people.
Yeah. Yeah. I mean, there's been a change, my parents, for the most part, they were a little tougher on me. So it was like, I think, a culture more when, if you got sick, unless you were like dying or something, it was kind of like, suck it up. Nowadays, a lot of people are more concerned with it, but I wasn't sure if it's that they're just kind of saying, let's just go to the doctor because we want to make sure it's nothing serious. We want to be preventive. I mean, you can do so much online today. So I would imagine that with the internet and the amount of information that's out there, specifically which we'll talk about later with AI and ChatGPT and all these apps, that the demand for clients, in the office would go down significantly. Are you seeing anything like that?
I don't think so. I mean, I know what you're saying. I think that there's certainly more individuals that are Googling things and ChatGPTing things. But first of all, there are just so many people per doctor, so many more individuals per doctor that there's no shortage of for doctors. I think on the individual level, you might be right, if that makes sense. Like, somebody might not go to the doctor every single time when they have a concern because they might look it up, but there's so many more people wanting to go to doctors and not enough doctors. So it's really like much longer to get into a doctor than ever was before. So I don't see that the doctors are really seeing that, but you might not individually go in as much because you might look things up. But then on the flip side, now we have too much information, so people look up things all the time that they wouldn't have gotten for before, and now they get worried about something they don't need to be worried about. So
Yeah.
I think it goes both ways, because many people come in because they're worried. They Googled something and now they're worried it's the worst case scenario. And if they hadn't never really looked it up, they probably wouldn't have come in. So I'm not sure that we're quite at the point yet where it's really decreased overall all visits. I think in the future, if we have like a robot or a better system that can kind of do the whole visit, then maybe you're going to see decreased visits because you can kind of go through things. But now people just Google it, they look it up, and the system's like, oh, it could be cancer, it could be heart problems, it could be this. And you're like, oh my God. And it's really just a cold, but then makes you call the doctor and go. So I don't think we're at that point now where the information calms you down enough to not go in, if that makes sense.
Yeah. And even if it ever comes down to the robots, they'd probably be working for you anyway. So
Probably.
they're not going to just let them work for anybody, Tell me why there's so few doctors. Would you know this stat, like as a percentage of the population of the U.S., how many doctors are there per capita? Like, is it that the amount of doctors has shrunk, or is it that just the population is much larger and they're not getting licensed fast enough?
I don't know the specific numbers, but what I know for sure is the population's growing, and making and training a new doctor takes a long time, and fewer people want to go into medicine in general. It's just not as great a job anymore, and more doctors are retiring earlier, given the reimbursements are tough. It's really expensive. So I think the number of doctors is shrinking, or certainly not growing at the same rate as the population. And I think the more people are just getting want healthcare and do go see doctors, is just something that's more common, and we have better care for individuals that are not as financial, aren't doing as well financially, if they still have healthcare in general right now. So there's a lot more people that want to access healthcare with not really more doctors.
Got it. Now you worked for a private practice before you started your own business. I think it was 2018, right? What
Yeah, sounds about right.
what was the biggest motivation for going out on your own?
I wanted to be my own boss. I mean, I didn't want to make money for somebody else. I didn't want to have to answer to somebody else, and I wanted to be able to take off when I felt like, be home when I wanted to. I think in terms of a lifestyle, that for me was the most important thing. At the end of the day, when I asked myself, like, what do I want to do? I don't want to have a boss. I don't want to have to ask to take a week off to go on vacation or to go to my kids' events. I just want to be able to do it and have whatever schedule makes sense for me. And that's why I went off on my own.
Yeah. Do you find that you work more hours now that you own your business, or it's just you're more flexible?
Not at this point. So I've been in it for a while now. At the beginning, I definitely worked more because it was, just me, not very many staff, and we were trying to build up, and a lot of the work was just trying to get people to come in the first place. And then at this point now, when things are kind of running themselves and I have a couple other doctors in the office, then I don't have to work nearly as much, and I have a lot more free time to do the social media and other things, and write books and do all those other things. So at this point, no, I think it's a curve. And at the beginning, yeah, it was more work, and now it's less work. It's definitely more work to own a practice than to just work in a practice, but I don't necessarily work more overall. I work way less, but I just have to do administrative stuff too.
Understood. Now, here's a question that I have for you that I still don't understand. Tell me why doctors that go out and start their own practice still volunteer and even work part-time at a hospital. Aren't they competitors of yours?
Well, a hospital's not really a competitor because you're doing different things. So it depends on what kind of doctor you are. But classically, so if you go back really before the internet, the way that you would get a lot of your patients would be through the hospital. You meet people there, you're taking care of people, you're getting to meet them, especially if you're, in my practice was pediatrics, like you're meeting newborns, so they come to your office. There wasn't an easy way to get new patients other than word of mouth back in the day. It's like, who did you go to? I go here. You don't, you can look in the phone book or something, but now people, more search online. So you don't have to work in the hospital. A lot of people like it. It's different style. You're seeing more acute things. But yeah, you don't have to. It's not really competition, because if you're in the hospital, you're super sick, you're there for other reasons versus just your generalized care in the office. So they are separate, but I would say the trend has been moving away, that most or many doctors are no longer going to the hospital anymore. They're no longer working there. They're no longer seeing patients. The hospitals have their own doctors, and they just take care of you when you're there, uh, which is really much more practical. So you don't have to drive there to see one patient.
Yeah. But there are services that you offer that you both do. Is that correct or no?
So what do you say it again? What do you mean?
Does the hospital offer some services that you also offer? Like if you feel sick, I go to the hospital if it's serious. If I'm sick, but I'm not so serious, I might go to a local practice. But I imagine there is some still I guess similar services that you can both offer, even though you specialize in something, or the hospital focus on really like specialty, surgeries, whatever.
Yeah, I mean, the overlap would be in sort of the acute issues that might pop up, where somebody feels like they need to go to the hospital or the emergency department when instead they could have come to your office. So the overlap, I think, is mostly there, where they could have used your services. They could have seen us. We could have avoided having to send them to the hospital. But it's not a lot of overlap, because most people don't want to go to the emergency department. They don't want to sit there for 10 hours. They don't want to be exposed to the germs and other things. So in general, it's
Yeah,
not really competition, and they're there on off hours when you might not be available. So it's a little
yeah,
bit different, but there's certainly some overlap.
yeah, that's another thing too. I mean, they work strange hours that well because they've got so many individuals working there. You can go there at 2 a.m. in the morning. You're not going to be there.
Correct.
Uh, yeah. So what are you working on these days? I mean, between your social media, your books, and your practice, what are your goals? What are you trying to accomplish?
The latest thing I did was have done is work on a vaccine book. So that's what just came out, Between a Shot and a Hard Place. And I have been trying to work around advocacy around vaccines in the last year and really push a balanced approach, a balanced discussion, and really try to open that up. It's been something that's been so censored and frustrating for a long time. And it's the thing that people want to talk to me most about online at the office. And it really wasn't something I talked about a lot online before, just because it was so controversial. It's still controversial, but we're talking about it a little bit
It-
more now, which is great. So that's been my current big project, because that just came out, and it does seem that people are very excited about it. A lot of shows and podcasts and other opportunities have come up just because people haven't really talked about it in the past, and this is giving them an opportunity to do it. And I think people are noticing that it's not really getting censored anymore, which is nice. So I'm getting that opportunity in this wave behind Secretary Kennedy, who is pushing this discussion more than it has been in a long time. So that's really the big project at the moment.
Got it. And why do that? I mean, you obviously don't have any connection as far as making income from that. That I think so, at least. Like, why try to become a thought leader in that respect? What benefit does it have for you?
I I think it's an advocacy. I mean, it's really just for the future of health. It's something that's really found me. Parents have been asking me about this for a long time, and it's what I've been seeing. Um, the trend and the concerns that parents have on social media and just in the office as well. And I felt compelled to do something about it and to write down what I know and what I have said. I feel like I had something to add to this discussion, and I mean, I do think if you want to talk about it from like a selfish perspective, there's certainly possibility of making money. I mean, you make money from books if it does really well. You can make money from selling things if you want to sell things. But I think from a connection standpoint, it is actually very helpful.
You're
There
talking
are not
about
that many.
mainstream books, not like specialty books. At least I don't think so. I mean, I don't. I would think you'd have to sell a whole lot of books, so it'd have to be like a very mainstream subject. Even though, yeah, vaccination is a
Yes and no. I mean, something that it's both sides, because it is niche, but at the same time, there's not as much competition. There's not a ton of vaccine books. There's not very many people talking about it. So I think from the my personal standpoint of the ability to kind of climb the ladder, or whatever you want to call it, and get onto bigger shows and bigger podcasts and be around other people, this is an opportunity to do that because people are really interested to talk about it. My first book was about parenting, and there's a lot of parenting experts out there, a lot of parenting books, and it was great, and I had a good time, and I got on lots of things, but nothing like this. This is just piqued an interest for people. So I think if there's an angle there, and I don't know that there's really an angle, but like if there is, it's like I get a chance to be around all these really cool people and talk to really cool people and have very
yeah.
interesting discussions. But I think it's just like I like doing it because people are genuinely interested. They're really interested in talking about vaccines, having a balanced discussion. They haven't done it before. And I find that very engaging and useful. I mean, people gain a lot of use from the conversation. They can ask their own questions, and I never really had that before.
Yeah. Is there consensus among the medical community regarding vaccines? I mean, they're still handing them out, so I imagine most are for it. I have friends
Yep.
on both sides of the equation. I mean, it is one of those things that most people are, well, there's some people in the middle, but there's a lot of hardliners where they'll just do no vaccines whatsoever. And then others that will just say, if the doctor recommends it, I put it, put 5, 6 vaccines a day, or however many they do. But is there consensus?
In the medical community in general, it's the standard of care to give the CDC schedule that most doctors feel very strongly about vaccines, almost all of them, and really do try to push the regular CDC schedule. Unfortunately, I would say online, for the most part, you hear the extremes. You hear the people that are, very, very strongly opposed to them, very, very strongly for them. But the majority is really somewhere in the middle. And the vast majority of the literature out there is very extreme. Like you have the CDC, like everything's great, and you should get all your vaccines; they never cause a problem. And then you have other people talking about how the worst things ever, and they're killing everybody. And that's not helpful to most parents, and that's not most of the people that come to me or talk to me. They have questions, they have concerns, but it doesn't mean they don't want to do it. They just want to talk about it. And I
Yeah.
think that's where I could be different, and the book can be a little bit more nuanced. And I've seen that. I mean, people have so far been very positive around the discussions I've had in the book because it is nuanced and it goes kind of back and forth and shows both sides, which very few things do thus far. So that's been nice. It's been nice. I didn't know how it was going to be taken, how things were going to go, but so far it's been great.
Yeah. Something that I find very interesting are the stereotypes among, when I talk to people and say, what do you think about your doctor? Are they generally in it for the money? And they'd say, no, of course not. They like to help people, and they're kind people, and they're doing the best for their patient. But then when I go into like the pharmaceutical side, it's like everyone thinks that they're in it for the money, even though I imagine most people that run these pharmaceutical companies are doctors anyways. And so then you have the vaccines. Where do they stand? I mean, are they also by the pharmaceuticals?
Vaccines are by pharmaceutical companies, yes. But I do think you have to separate a little bit when it comes to pharmaceuticals about the people who kind of run the business side of things versus the scientists. I would guess a lot of the scientists are in it for the science and in it for the discovery,
Hmm.
because they're not usually, I mean, some of them maybe, but they're not usually getting paid the big bucks. It's usually the administrators and the CEOs and the individuals from that end. So I think the people that kind of push the medications and push uh, what you're using it for, the marketing, all that stuff. That's where I think people do think that it's really about money, and a lot of it is. That's their job. I mean, their job is to make money. I don't think the
Yeah.
scientists who are trying to find discoveries are really in it for that. They're trying to save people. And yeah, and I think for doctors, yeah, most doctors are not in it for the money, and a lot of doctors don't make that much money. I think it's something that people think, but a lot of family practice doctors don't make very much money for how much they work. Some
Yeah, the
surgeons make
family
a lot of
practice
money.
doctors don't. The specialties are
Yeah,
from what I've heard, they make a good amount of money,
they
but it's
can.
fine. Like I said, as long as the market's free. Let's see, what was I gonna ask you? Man, I lost my question, my train of
But
thought on that
I was
one.
going to say, I don't mind my brain surgeon making a lot of money. I don't really care. They don't have to be the nicest person, and they can make all the millions that they want. If they can cure your brain, then that's good. I say, I have, and they also, I mean, they train for a very long time. So you might make, $1 million a year or whatever it is for those surgeons, but they've been in school for 15, 20 years making almost nothing. So I think it's a very long road, and those individuals that do climb to the top and are willing to do it, I think it's the kind of job that you do deserve, the big bucks much more than like an athlete or
Yeah.
singer or something. Like that's a good person to be making a decent amount of money. So that doesn't personally bother me that much.
Right. Yeah, and you don't want to choose a cheap brain surgeon if you're doing
Yeah.
something that's serious. But no, I was surprised. I have a friend. I won't name his name or where he works for anything, but probably he's a very specialized uh you know position that he has. And he's probably been out 6 7 years out of residency, and his income is probably close to that 2 million range. And I found that like to be, I was like surprised how high it was, because even when he was in residency, he would mention to me that in large cities you would make maybe 5 600,000, 500,000. In small towns where there was a lot of demand, you could make up to 7 800,000 with this residency. And so I was very surprised to hear that. But anyways, that's not the point.
Well, yeah,
Uh,
but I think for medicine, it depends if you go private practice or not. If you make your own practice and you make your own hours and you work a lot and you do something very specialized where you can make a lot of money, like short surgeries, that kind of thing, or you go in like cosmetic surgery or plastic surgery, those some of those individuals can make a lot because you can turn over a lot of high paying um, projects or surgeries, and they can do it if they work a lot. So it's certainly possible, but I think the numbers you're quoting are much more in line with the average, which is the average doctor is going to be making, if they're a surgeon and they're working a lot, they're going to be making that kind of range.
Understood. So, what kind of problems are you facing these days that are, I mean, what's your biggest problem right now? It doesn't seem
Insurance.
like you have a need for clients. I mean, it seems like there's little doctors, a lot of patients. Uh, what's the issues you're having now?
I think it's the administrative stuff, just dealing with insurance, dealing with billing, all the stuff that's outside of actual medical practice. Just dealing with insurance in general is always a nightmare. It's never easy. They kind of control everything in medicine. There's not really much you can do about it because you can complain, but then they just, they don't answer, or they just be like, oh, too bad.
And you can't outsource it. There's no companies that allow you to take that
Well,
side
I
of it.
mean, so we have billers, but that they're not the issue. It's when you submit things to insurance, They can deny things when they feel like. They can make it very difficult for you. They don't increase what they pay you very often. So the cost of everything goes up, but they don't really change what they're paying you. So it makes it more and more difficult to be a doctor. And that's why a lot of doctors have gone out of business or get bought up by big hospitals that have better negotiating power, because you trying to negotiate with like Blue Shield or Blue Cross or United, they don't care about you. You're like, no, you're not paying me enough. They're like, okay, too bad. You're talking to somebody in some other country. They don't care. So it makes it really difficult because the cost of things have risen so fast that a lot of doctors can't keep up. They're not getting paid enough. And if you're getting paid 50, 70, 80 bucks, 100 bucks, let's say, for per patient, with all the costs and fees, and you have to pay for billing and pay for credit card fees and pay to chase people down, it ends up being, 60, 70 bucks a person. It's like you can't stay open very long unless you see 5, 10, 15 patients an hour. And that's what people are doing. They're seeing so many patients. So you either don't stay open, or you have to give on your care and do shorter visits. And so that's a
Yeah.
big issue with medicine right now.
How many of your, like, what percentage of your revenue is from private insurance, or let's say, Medicaid?
So we don't take Medicaid. So it's every patient in our office pretty much has private insurance, except for a few that just don't have insurance, so they just pay cash. And so that's where our revenue is from.
Got it. And most of your, I guess your services are general. Do you have any specialized services like, do you do surgeries? Do you do,
No specialized services. I mean, we do some lab work and other things like that, but it's all, I mean, if you're saying anything of specialized service, it's giving vaccines. That's the main procedure that you do in pediatrics, but it's mostly just the basics of medicine, and you're getting paid for your services. And then sometimes like for forms and other little things people pay cash for.
yeah, yeah. Are there, I know, I guess pediatricians would focus on children. Do they have specialties as far as, like, is an orthopedic surgery just work for everybody, or is there like an orthopedic surgery for children?
There is. So there's subspecialties for pretty much all of them. So you would, like, for example, orthopedic surgery, you would do your residency in orthopedic surgery and then do a fellowship in pediatrics, orthopedics. So it's not like a pediatrician can do that. It's a surgeon who would want to work with kids. So it's like more training even than regular. So the people that go into pediatrics, they really have to love learning. They have the super long residency, then they do more to do pediatrics.
Yeah, yeah. And you've chosen, I guess, to stay within the general. I mean, you're not planning to branch out horizontally for different products. And what's the most common thing you
I
get
mean,
in your office?
yeah, not so much. I mean, we have some like private label supplements and other things in the office, so it's more for convenience than anything. I mean, you make a little bit of money. It's not like a huge amount, but it's just convenient there for them to be able to pick it up that day instead of having to go somewhere else to get it. And
Yeah,
we just have the basics, like vitamin C and vitamin D, and immune blends and those kinds of things that people might go to Whole Foods or wherever and get. And they're just ones that I've liked, and the companies that I've worked with in the past, that I find very useful. So we just have some of those available if people want them in the office.
got it. How effective are those things? I mean, I keep hearing that supplements have, like, again, there's people on both sides. So there's people that take supplements all the time. In fact, this weekend I was recommended to take magnesium.
Mhm.
But then there are the people that obviously keep saying there's no proof that they work, and there's so many of them.
Oh,
What's
they
your
work.
recommendation?
I mean, they work, right? You think about coffee, right? Does coffee work when you drink it? Like you feel like you have to be realistic, and then it depends on which supplement, how good the quality is, and what you're using it for. But we know that a lot of these things are useful, and there's tons of data on some of these things. Like magnesium is really good for constipation. It's good for calming. You can have some chamomile tea, and it calms you down. Like you shouldn't be expecting some sort of magic. It's not a cure for everything, but they can help a little bit. So yeah, I mean, vitamins work. I mean, we know what happens if you don't get vitamins, right? You get vitamin deficiencies, you get scurvy and rickets and other things. So vitamins are important. I mean, ideally you get it from food, but there's a place for some of these things, I think.
So you're a fan of multivitamins, I assume, or no?
Well, I mean, I'm a fan of getting the vitamins you need from food, but if you're not getting it from food, then a multivitamin is a reasonable alternative. And I think that a lot of people are picky or just don't eat that well. So multivitamin is a good way to make sure you're getting at least a little bit of everything. So I'm not like, I guess, for it or against it, but I think it's very reasonable for a lot of people to do it.
Yeah. Is there something in between? vitamins that we I had a guest last week owned they're like spas, clinics, but they do a lot of IV therapy.
So I wouldn't say
Um,
that's in between. I would say that's a more on the extreme. So in between would be like if you're getting like wellness drinks, supplements, teas, that kind of thing. So it's more food based. Then you have your supplements, and then the IVs would be more extreme, like you're giving bigger doses, injections. So that I would think that's like that's taking supplements to the far end, which could be good. I'm not saying it's
Mhm.
bad. I'm just saying it's not in between.
But yeah, now that I think about it, he mostly works on like athletes and like guys that want to have peak performance, that sort of
Yeah.
thing, you know?
Exactly. It's peak performance or those that are sick. So you're very sick and you want to get an IV drip of vitamin C or some other very specialized thing. So yeah, I think it's more on the extreme end.
Yeah. Well, what would you do? I mean, you mentioned that getting paid is your biggest issue. I mean, if you made the decisions, how would you do it so there's not a conflict of interest where, maybe doctors would overcharge and that the government would, pay a fair price? I mean, we know that, and you mentioned it earlier, that medical costs or healthcare costs are going up significantly. I don't know if it's because many people are going more to the doctor, people are sick a lot, or what would you do? What would be your system?
I mean, I think a lot of the money goes to the middlemen. So I think that's where the issue is people are paying a lot more money for their insurance. They're not getting as much, and then the doctors don't get paid as much. So I think there has to be some better rules in the middle, or you let people directly pay the doctor. So especially with the system as it is right now, for a lot of individuals, they pay so much, they don't get very much, and the doctor doesn't get paid well. So you could have some sort of system where you can pay them directly. I think the most important thing is emergency care or bigger items. So that's where insurance really does come in. I think that's important, and we should still have that. But there could be some sort of hybrid where people could pay more, or you just have doctors or groups like actually advocate for doctors if, just from the medical standpoint and be like, all right, like here's the cost of things going up, like we're advocating together, and you have to raise your prices to pay us appropriately. Like, the insurance doesn't have there's no push to make insurance do the right thing, and pay people appropriately or increase things, with inflation or as things get more expensive. Like
Yeah.
you can buy a test and do the test on somebody and then get paid less than the test cost you. That's not that abnormal anymore. So
Yeah.
it's not very easy to negotiate those things. But I think if there was like a united front to be like, all right, well, here's what you need to pay for all doctors, but everybody gets paid different, every context different, and every office is different, and so it's so fractured right now.
Right. Now, these are public or private insurances that are publicly traded or something, but so are you saying that these companies are not paying enough? So really the expense that we have for healthcare is really low. It could be potentially much higher if they're forced to pay you more. Maybe not the private companies because they're insurance companies and they're for-profit businesses, but for the people that do accept Medicaid or Medicare,
Yeah, so
uh,
that's two different questions, because I think for Medicaid and Medicare it's a much bigger question, because yes, if you're paying doctors more, that would make the cost go up. But and that's I don't know. I don't really deal with Medicare, so I don't know. I think the answer for that one is in general we got to get people healthier, so we have to try to work on prevention so we can decrease the overall costs. For private insurance, a lot of the money goes to paying the company, so they make billions of dollars and trillions of dollars. So it's really just decreasing what they're making a little bit. They can still make a ton, but maybe doctors make a little bit more of a little bit more reasonable amount, and they make a little bit less of a billion. So I think for private insurance, it's not that hard. For the public insurance is much harder, because they obviously pay the worst, and that disincentivizes people from taking Medicaid. Like, for example, I couldn't take it. Like, if I was to take it, I have to see 10, 20 patients an hour. You couldn't do a model of integrated medicine and see people and talk to them for 15 minutes or half an hour. It just doesn't work. You have to do one or the other.
now, what's the problem? How do you feel about telehealth? I used to hate going to the doctor's office,
I
mostly
like it.
because they'd give me a time and it would be like worse than the DMV. I've sat like for 2 hours in the doctor's office, and I thought, wow, it's like a disrespect of my time, you know? I imagine it was just this doctor, but are you guys currently doing anything like that for
Oh yeah, I
virtual
mean
health?
of the pandemic, of that's the best thing to come out of it for medicine. People's comfort in doing telemedicine, it's so much better. There are obviously things you need to see in person, but there are many things that you don't need to see in person. And so, from the doctor's perspective and from the family's perspective, it's fantastic. If you wanted to just have a discussion about something and you don't need a physical exam, you save the drive, you save the wait, you save the drive back, and then everything's the same for both. It's just so much easier. So I think that's a great thing as a part of medicine, and you have to be careful with when you use it, because sometimes you can miss things from telehealth because you can't see the person. So that's just the downside of it. But for the most part, it's really good, and there are many, many, many things that don't need a physical exam, so you can do it. And even with a physical exam, you can tell the person what to look for, and then they can come in if it's not getting better. So yeah, I think it's a great part of medicine.
Yeah, yeah. I mean, you can have centers where people go and like a nurse takes pictures or whatever she needs to, but it would at least save up a lot of your time, which I imagine they already do. I mean, PAs and nurses for the most part already do a lot of the work. But I thought it was interesting, and I do like the concept of cutting the middleman, because you're right, there is a lot of bureaucracy nowadays. One thing that I think I read about you, correct me if I'm wrong, but you have an annual kind of subscription model.
Yeah, so that's the way that we're able to, stay open, really. So it goes back to, you either have to have some sort of other way to make some income steadily, or you have to see a lot of patients. You can't get paid enough just to see patients, and in the current model, like you'd not be open.
But for individuals that, let's say, don't have insurance and they wanted to have just a subscription fee, which is not going to be as expensive, remotely as close as private insurance, I guess you are cutting the middleman there, right? They would just need to have insurance for like extreme circumstances, like emergency room stuff.
Yeah, I mean, it's hard to get insurance like that, so that's the problem. So a lot of people still would have to have insurance, but if you get, so there's things called health shares, so it's like run by churches and other things,
Yeah,
where it's
mention.
kind of like insurance. So there are those, and a few people have that, and I think that's a good model for the doctor and the patient. But in general, yeah, I mean, if you're paying cash, you're just paying to come to the office, and maybe people have their insurance in case they go to the hospital or whatever. So
Yeah.
you're kind of paying for both, and that's what makes it tough. I mean, you can just take no insurance as a doctor, and some doctors do that, but for most people, if they're paying a lot for insurance, they want to be able to use it. And for kids especially, it's hard because vaccines are extremely expensive. And if you are doing vaccines and you want to use your insurance to get those vaccines, because those will be covered in general under your insurance, and it gets extremely expensive to pay cash for those.
Yeah. Tell me about the med shares, the sharing plans. I know they're not insurance companies. I have a friend that uses it and highly recommended it to me. What I don't understand is why they're so much cheaper than insurance companies. His, I get the reason he liked it is because it was a Christian organization, and they didn't cover, like, if you're a smoker, for example, they didn't cover you, and they didn't cover anything that was what their values they consider. So no, what's it called, abortions. They didn't cover a lot of sex changes and things like that. That's why he liked it. But again, not many people are doing these kind of things. Why are they significantly cheaper?
They are cheaper from my understanding. Number one, because they're more not for profit, so they're not really trying to make millions and billions of dollars. They're not run to make a profit so much as a bunch of people paying in to support those that need it when they need it. So it's more community based. The idea is what insurance used to be, I think, where you pay in and you pay a certain amount, and then for those that need it, for have a catastrophe, it'll pay it back, and so you're kind of all paying in for you to get at the end, as opposed to paying a CEO's salary or other people's salary. So I think that's one part. Two, it's smaller, so they work harder at negotiating prices down. So if you have a surgery, then they're going to have more incentive to try to work to get that cost down, as opposed to the big insurance company that doesn't really care, and it'll just pay whatever. So I think they work to get the cost down, but also they just don't have the same um, administrative middleman costs and trying to pay people to make money. It's more about, we just need enough money to cover what everybody needs.
Yeah, they had their own network of doctors too. Of I don't know why, honestly, but yeah, it's a complicated structure. Each insurance has like their locations you can go to, and to this day, I still don't understand it much. But thank God I've been fairly healthy, so I haven't had to experiment with the system much. Um, so who are your main competitors today? Are
Main
they local
competitors,
guys?
yeah, I mean, other doctors, other offices. especially for me, like other integrative practices. So they're certainly, I guess, competitors in the sense that we need patients and someone could go to a different office. So it's not. I don't at the moment. I don't have competitors for the regular office because we're like pretty full, so it's not really an issue. But if
Yeah.
we weren't full, then it's like you're competing for the kids to come to your office.
Yeah, yeah. Well, I imagine that's why, maybe working with the hospital, since you meet so many people having deliveries, that they would recommend you. That's how I have a 2-year-old and a 7-month old, and that's how we ended up in our pediatrician. It was recommended to us by the doctor that delivered our baby.
Mm-hmm.
So we just, it's a trust business, she recommends it. My wife said, I love it. I love her. And I don't know where she graduated, what she did, but she's recommended. Let's use her.
Right, and that's where I say, that was the old model, right? Like that, it's still around today, and that still happens, obviously. But I feel like in the past, you ask why do you go to the hospital? Like that's the way that it was. If you needed to be seen there, that was the hub. You got to get to know the nurses that work there and the OBs that are giving the birth, and all the people that you're gonna have a touch because they're gonna be like, oh yeah, Dr. Joel, we love him. You should go there. And you're like, okay, I don't know any doctors, sure. So you do. Now it's not as important because of the internet, and you can be seen in some video about whatever discussion, and then the parents like, oh, I like that guy, oh, they work in my area, okay, I'll go there. So you have
Okay, but
you have different avenues to get patients, so both are useful. I mean, you can go the
yeah.
other way too, for sure.
But wait a second. I mean, if you're on social media, what are the chances that whoever saw that video is actually within a 10-mile radius of you?
I
Um,
think not bad because people that are around tend to follow you more. I think people tend to be in your area more than not. And of course, the majority of people aren't, but I think the more that you're posting, the more the people are seeing it. It's just like advertising. You are advertising to people, and people go to your office, so they follow you and they share your things with their friends. So,
yeah, yeah, that's true.
is the majority in your area? No, but if for every one for every 100 videos you post, if you get one client or whatever, like if you're posting every single day, you're getting a bunch of clients from that.
Yeah,
So
you get a lot of forwards from
yeah,
like your clients already, and Google Maps. I imagine those are the kind of things when you're looking for someone's specialty or something. That's what I do at least. But
yeah, they do it, and I think that the algorithms do promote it more to closer to your location. So I think it does do that a little bit on its own. But yeah, I mean, again, it's like all these things are true, but it's just a different world. Like you didn't have this as an option before. You had to network, you had to schmooze. That was the way you'd get people. Now you don't necessarily have to do that. You still can. Some people do, but I don't find a need for that anymore because people find me from online.
I got it. I got it. Tell me, how has AI done anything to the industry or to your practice? They keep talking about how in the future they're going to break through. It's going to have all kinds of breakthroughs on new medicines and everything. And I mean, I've been hearing that story for a long time, regarding the breakthroughs. And I mean, as we've just discussed, I mean, people are sicker than ever, and it may not be the medicine. Maybe it's just the people are abusing their bodies. They're eating all kinds of junk. They're not exercising. They're not doing things that are common sense. Having their vitamins like they should, and they're eating junk food. But are you optimistic about that, or do you think it'll just be another thing that really won't get people healthy if they just keep on their path of doing things that are unhealthy?
I think AI has a great potential to be extremely useful in medicine. We're gonna have to see where it goes, but I do think that it has the really great option of being very helpful to doctors if that's the way that we go with it. I mean, you can throw in some labs into the AI, and you can be like, all right, tell me what you think, and it can go through the labs and kind of give you some ideas that can be really helpful. It can also um, give you suggestions of things that you can do based on labs or based on anything that you see. It knows almost everything, whereas a doctor doesn't. I mean, what you've learned to what you've seen. So if you have a complicated patient and nobody seems to know what's going on, I think it's going to have a big use to throw in all the notes, all the information, all the data, and be like, all right, well, what do you think the possibilities are? And it can come up with random things you maybe never even heard of. So I
Yeah.
think there's a lot there that can be helpful for patients and a lot for people to do at home. As opposed to being able to have to go to the doctor, you could say like, all right, well, here's my symptoms, here's what's going on. I want a meal plan for this week. Like what can I eat that's going to make me healthier? What can I do that's going to make me healthier? It could be much
Make
more
suggestions.
personalized. Yeah, so I think there's a lot that could be very useful there. For me, it's very useful to be able to check over things, especially if I write emails and posts. I can put it through AI and be like, all right, spell check this, make sure it's written right, edit it, and it does a good job. I'm not so great at spelling, so it's like it's good at making sure that I don't have to hire somebody anymore to like go over my emails and stuff. I can use it, which is really
Yeah.
nice. So it's a really good tool if you want to use it.
But it hasn't necessarily, at least today, revolutionized anything that you're doing. I mean, if tomorrow they shut off the system, would you be like, it's okay, I enjoyed it while I had it, but it really hasn't changed a whole lot?
The main things, no, I don't think it's changing any major part of medicine yet. Not in the like the front lines of medicine. I'm sure it's starting to change things in the back end and the billing and insurance companies, and they're using the technology for that. But I don't think you would see any real impact on medicine yet. I think it's coming. I think there will be. I think you're gonna have your little wand and you're gonna wave it over people, and it's gonna be like, oh, we have this, or you're going to use it and it's going to look at your rash and be like, I think it's this rash. Like, I think that's coming. And a lot of it exists, but it's just not mainstream yet, and maybe just not so perfect. But it's really interesting. Like a radiologist's job, a doctor who looks at your X-rays, whatever, that's going to be gone soon. Like that's going to be gone. Like maybe they're going to be work with the AI, but they've already shown many times that it does a better job than a human at looking at your like at your cat. Like you have to physically go through and look at an MRI and do it. Like that can look at the whole thing and compare it to 100 million other pictures and come up with a really good plan, better than most humans can. So I think it's going to change the industry, and some of the jobs will be gone, and other jobs you'll be working with it. But it has a lot of utility in medicine, I think.
What about, let's say, an application that there's interesting applications that you take a picture of a plant and it'll tell you exactly what plant it is.
Mm-hmm.
Um, is there anything like that today that somebody could just take a picture of a rash or something and it'll tell you exactly what it is?
So you can do it. I mean, you can take your picture and put in a chat GPT or any of those. It's not perfect yet, but
No,
these
but
things exist.
you
So
mentioned that the AI is better than the guy that checks the MRIs. So my
a lot,
question to you is
yeah.
is the app that takes the picture, is that better than you?
Is the app that takes the picture?
Yeah, like
Uh,
of a rash, let's say, and you say it's listen, or like let's say some kind of fungus that you have, will that be able to more accurately describe the type of, let's say,
I think
rash or
so.
fungus or disease than you would yourself, or no?
I think so. I think it will be better. It's probably better already at a lot of things. A lot of times you just don't know. Like you look at it, yeah. Like for example, as a doctor, you can be trained fairly well and like, okay, this is concerning. This is something we have to do more about. But a lot of times you just don't know what it is, because a lot of rashes look very similar. I think
Yeah.
those subtleties might be better able to be discerned by AI. Like you might be like, well, I think it's this virus. It doesn't really matter clinically, but you can kind of tell if it's a bad rash versus a good rash, and that's what matters as a doctor. But I think, yeah,
Right.
I think they're going to be able to look at those things. I think you're going to be able to put up the little thing to a mole, and it may not be better always right now than a dermatologist, but for let's say someone like me who's a pediatrician, like I look at rashes, but it's not my specialty. It's not what I do every single day. So if you get some sort of weird looking rash, yeah, I think a computer could do a much better job than me. Maybe not than the professional dermatologist who does it every day, but it could be very useful to the average doctor who doesn't have training in those things.
Yeah. Well, I see it as a tool, if it
Yeah.
is better than you, I would use it. Obviously the technology is not going to be, there's not a robot yet that can do that for you. Until that happens, you still need somebody to run the system, and again, many things have look very similar, but then that's where the symptoms come in, like maybe some rashes or some, whatever sicknesses don't have certain symptoms. So if you have that, it eliminates that.
Yeah,
But
I see it at least for a while as being a fantastic tool, and then especially with something like rashes is just a perfect example because you could be like, all right, what do you think this is? And it's going to cue you into the top 5 things that it thinks it is. It's probably going to be one of those 5 things. And then you as a doctor are going to have to look clinically like you mentioned. But it's going to make you think. It's going to help you think. And I think that's a net positive for patients. We have to have some humility. Like that, these computers are going to be good. They're going to be better than us at these things. We don't see some of these rashes every single day. We're not a dermatologist. So why would I know every single rash all the time what it's going to be? They don't either. But a computer can.
yeah, yeah. Well, what concerns you about the industry? I mean, if you had to leave us with one thing, what's your main message on social media? What would you like to get out there?
My biggest concern with the industry right now is that I feel like it's so far out of balance. I feel like we're there's so much fighting, there's so much anger when it comes to healthcare. There's not enough discussion, especially with individuals like Secretary Kennedy who are now in power. It's a very different mentality than a lot of doctors actually have, and we have to find a little bit of humility to say, look, like, we're not that healthy. We're spending more than all these other countries. We're certainly not healthier than other countries. What are we doing wrong? What could we do different? Where can we make changes? And let's focus on that, and let's try to find the things that we do agree upon and work on those, and then try to find some balance or a bridge between the things that we don't agree upon. But right now, our health is terrible and our outcomes are terrible, and the amount of money we're spending is way too much, and it's not sustainable. So I feel like we got to find somewhere in the middle.
Yeah, I agree. So the goal is not really to have more doctors. It's obviously to get the patients much healthier. So
Yeah.
maybe, I don't know, like self-help books, but I mean the books have always been there. It's just the people, they need motivation. It's
Mhm.
almost like the gyms. I mean, there's probably more gyms than ever.
Yeah,
But
I think
people
it's
don't.
one part of an understanding of that, but also just maybe a push from the health community to focus back on prevention and to push for some advocacy and public policy. I mean, yeah, there's more gyms, but like, how do we get people to go to them? Can we have that covered by insurance? Can we motivate people to do it based on the things, the tools that we have? Like, we can make it cheaper, we can make it free, we can let you use your tax-free dollars. You can make healthier food cheaper. Like, a lot of the shitty food's cheaper. We got to make healthier food cheaper. We got to make it more accessible. Like, these are things that doctors can continue to push and advocate for, that can make it easier for people to make better decisions.
Got it. Well, listen, I want to thank you for your time. I mean, I know your time's very valuable, and it means a lot that you would spend here a good hour with me. And I wish you the best, and I hope that we can make this nation much healthier. If we're gonna make America great, keep it great, I think we definitely need to be healthier. So thank you for chatting with me.
Thanks for having me on.
Made in America.